Okay, so for the today's session, we welcome uh, Lisa Rebello, who was alumnus of Wilson College Physics Department. She did BSc in Physics many years back. We say BC period before Corona period, and now then she did MSc in Medical Physics, National University of Ireland, Galway. Uh, then she started working, in as medical physics technician first, and then she is now working as
No,
medical
मीटिंग है
physicist
मेरी।
radiotherapy.
अरे वो
Just a minute. Yeah, sorry. So she has done MSc in medical physics, and then she served as medical physician technician first, and then now she's working as medical physicist radiotherapy at Cork University Hospital in Ireland. She has been doing research projects, and her research projects include this automating 4D CT scan test using uh, PyLinux library in Python, then dosimetric evaluation of HDR cervical brachytherapy treatment using Excel and Python. So you can start seeing that the Python and Excel and the data analysis, all these basic skills is helping her to do this work. I mean, the modern technology has changed the life in different ways, and her other responsibilities include, apart from the regular duties of calibrations and maintenance and generating reports, the important things about commissioning new tests and diagnostics, treatment planning, discussion with radio oncologists on treatment plans, and so on. So we welcome you, Lisa, for this talk, and thank you very much on behalf of John Wilson Education Society and Wilson College, and especially physics department, for agreeing to give this talk, and especially talk about various career opportunities that we can have in this field of medical physics. Many of these things are really not known very well when people are doing general graduation. So it will be an interesting area. And this recording, thank you for giving us permission to record this session also, because this recording itself will also serve as an important document as well as resource. We'll be uploading it on our Wilson College YouTube channel. Thank you and
Thank you,
welcome.
thank you, Mahesh Shetty, sir. And I'd like to thank the physics faculty for giving me this opportunity today and for the kind introduction. It's very nice. So I feel very grateful to share my experience and knowledge to you guys, with you guys, and hopefully I'll be able to make some impact. So thanks very much for having me here. I'm really truly honored. So welcome all of you. And my presentation is going to be Introduction to Medical Physics, Career Pathways for Physics Graduates. My name is Lisa Rebello, and as Sir said, that I'm a medical physicist in the radiotherapy department of Cork University Hospital. I'll be going through my career pathway and obviously introduction to the field, responsibilities as a physicist, key branches of medical physics, especially in the healthcare sector, and then how to prepare for your career if you're interested, career progression, what opportunities are there, and I'll have some online resources or links if you want to visit and worth taking a look at if you're interested. So just my career path, as Shetty sir mentioned, that I finished completed bachelor's in physics from Wilson College, just like you guys will. Then I moved on to to do my master's in medical physics from NUIG, National University of Ireland of Galway, Ireland. And then I I applied for a lot of jobs. It was COVID time, so obviously it was difficult. There was freeze on jobs. I got into nuclear medicine as a technician, where I worked for a year and a half. And then I changed into I stayed the same hospital, moved on to the different department in radiotherapy physicist, as a radiotherapy physicist, for where I'm working now for 3.5 years. So it's been a very interesting and a difficult both journey, but it was nice. I'll go through my role and my responsibilities in my current role throughout the presentation, as I'm introducing you with the different different sectors of medical physics. So, just to give you an introduction of medical physics, like the name says, is the application of physics principles and techniques to diagnosis and treatment, ensuring safe and effective use of medical technologies like imaging devices like X-ray, CT scanner, MRI, ultrasound, and radiation therapy. So let's go on to the responsibilities of medical physicists. So these are just the key responsibilities. I am not going to go into a very detailed role responsibilities. We'll be here all day. So these are just the general and the main responsibilities of medical physicists. The most important one is quality assurance. So quality assurance is a huge part of a medical physicist role. So that quality assurance is a program developed or in place of a physics department to ensure the safety and accuracy of a medical equipment. So we are making sure that the machine, we are within the manufacturer specifications of the machine. It is safe to treat with that machine. The results are consistent, and that we are compliant with the legislation. So that's basically it. The next most important part of our job is radiation safety. So we of course care for the radiation safety of the patient, but we also are responsible for the radiation safety of all the other healthcare workers in the hospital, including our own staff. So monitoring and controlling the radiation exposure to patient and the staff safety is a huge role under the medical physics. The next huge main role of a medical physicist, research and development. So, medical physics as a field is always developing with new technologies, with new treatments. So, we are uh, always researching new techniques to optimize the treatments, to make it more efficient, to make it more safer. So that we can optimize it and our treatment and imaging protocols to ensure patient safety. So, researching and development is a huge part of our job. And then like any other field, collaboration and training. So we work alongside with healthcare professionals, again, to ensure safe practices. So providing radiation protection training to doctors, nurses, and other healthcare staff would again fall under medical physicists. So yeah, these are the main responsibilities. Obviously, there's a lot more to it in detail. So coming on to collaboration in medical physics, we work with, like I said, we work with doctors, we work with dosimetrists, nurses, and radiation therapists, and we all share the same goal: safe and effective treatment delivery of a patient for a patient. So coming down to the next one is radiation safety. Like I said, we are responsible for radiation safety of our staff and the patients. So, and ourselves as well. So, the way we do it is we call it as ALARA principle. So, as low as reasonably achievable. And we intend to get as low as reasonably achievable dose to ourselves, because we're working in radiation department for a long, we are working with radiation for a long time. And how do we do it? Is by using time, distance, and shielding. So obviously, uh, increase the time, like reduce the time you are in the same room as the source. So if there's a radiation source in the room, and if you're not if you're it's not necessary for you to be in the room, then you don't have to be. So unnecessary radiation exposure, so you reduce the time uh, with the radiation source. The distance, if you're handling the source, a radiation source, by hand, it's a good practice to use tweezers, so they are a few centimeters away from you and keeping it away from your body. So we're increasing the distance from the radiation source. And obviously using appropriate shielding, using lead glass or a lead shield wherever appropriate to shield yourself from the radiation. So these are the three principles that we use. And we apart from this, we still do get some radiation doses, and that's why we have radiation monitors. So these are called optically simulated luminescence dosimeter, or OSLDs. We call them whole body badges. So why they are called whole body badges is they record or monitor the dose to our body. So they are placed on an area from your chest to your waist, somewhere in between here. They monitor the dose, but they do not reduce the dose you get. So they are only used for monitoring what dose you're getting. So those are very personalized. It's a good practice to not share it with anyone, because that is monitoring the dose you are getting. So they are very personalized. They come with each of ours name on it. We are not sharing it with any colleagues. They are sent to the company every 2 months to read, and then we get the results back saying how much dose we have received. And then we have another something else called as the finger patches. So they are called as thermoluminescent dosimeter, or TLDs. They are worn on the fingers when you're handling any radioactive source with your hand. They record the dose to your extremities or your fingers. And again, they are also personalized. We can share them with our colleagues. They come with our initials on it, as you can see, and they are sent every month. They're replaced every month. They're sent every month to the company. They come back with the readings, and then you know what dose you have received. So the other thing about radiation safety is the signage. If you have ever visited a radiation department or diagnostic department, I'm sure you would have seen this sign, or if you visit anytime in future, you'll be looking for the signs now. So they are radiation control area and access restricted. So these signs are posted outside the control room where the radiation beam is being delivered. So these signs are posted in a room where background radiation is slightly higher than the natural background radiation, or where there is a risk of exposure. So any normal member of the public would not be allowed to enter a room with this sign. So that's another step towards keeping our public safe, public visiting the hospital safe using these signs. And why are we doing all this is because obviously there are dose limits by the regulatory guidelines. So by the international guidelines, the public exposure should not exceed 1 millisievert per year. And for occupational workers or radiation workers like us, it should not exceed 20 millisievert per year averaged over 5 years. So we have a bit of higher limit in case there's an accident or you're accidentally exposed to a radiation source, which is very generous because even though we work in a radiation field, we never even come close to 1 millisievert per year. It's very low doses. Even these record very low doses. So these are very generous, and we are not getting radiated more. If you think that we are getting radiated more than public, in case an accident, we have a very generous limit. So it's all safe. So key branches of medical physics. So there are three key branches of medical physics: radiology, nuclear medicine, and radiotherapy. So in radiology, physicists or in radiology department, physicists would be calibrating or quality testing machines like imaging equipments like X-ray, computed tomography, magnetic resonance imaging, and ultrasound. And nuclear medicine consists of positron emission tomography, that's PET scanner, scanner, which is single photon emission computed tomography, and then radionuclide therapies. And radiotherapy department is responsible for cancer treatment, to treat cancer treatment using ionizing radiation. You don't have to memorize all of this. Now I'll go along throughout the presentation and give you a brief introduction of everything and explain my role in my department as well. So this is a radiology physics or radiology department. Imaging equipment calibration is the main role of the radiology physicist to ensure all the radiological imaging devices, like I said just now, are properly calibrated for high accurate quality images. Now, most of us are all aware of how the X-ray tube works, so I'm not going to be going into that detail, but yeah, this is just an image of an X-ray generator, an object, for example, a patient, and an X-ray detector. And then this is a generated radiograph. So as a radiology physicist, they would be responsible to check some measurement, to check the calibration of this X-ray tube. So this is a setup of X-ray tube and a detector. So this is just an ion detector or ionization chamber, if you want to call it, which we
Lisa, please unmute yourself. I think by mistake it got muted. No, unmute, unmute.
Yeah. Is that?
Yes, yes.
Can you hear
Now
me
we can
now?
hear. Yes,
Yeah.
yes.
Sorry about that.
You can go to the presentation. Yeah.
Yeah.
We just
Yeah.
missed last 10 seconds. We missed last 10 seconds. So if you can repeat that
Yeah.
part.
Okay. Yeah. Thanks. Sorry about that. Yeah, so this is this is an X-ray tube, and this is a setup of X-ray tube with a detector or ionization chamber that we call it as a detector, but it's just an ionization chamber. And this is the setup where we measure the output or a dose delivered by the X-ray tube using a detector. So we measure the dose delivered at certain kV, certain MA, and certain parameters. So what we are checking here as a radiology physicist is that the dose delivered by the machine is what it exactly tells us. So that's basically it. The other tests for diagnostic imaging is call it image quality test. So this is called a test object, which is scanned, which is again placed here under the tube, scanned, and then we get an image of this. And it is, so this has certain line pairs and the gray circles. So the line pairs is what is used to measure the image resolution, and the gray circle is what is used to measure the image contrast. So so this is tested so that we make sure that a patient is not misdiagnosed. So that's an image quality test. This is an actual image of when I was doing the QA, so a few weeks ago. So this is a CT scanner, and the tube in a CT scanner goes around a patient 360 degrees. This is a water equivalent phantom. So this is a setup of a water equivalent phantom with an ion chamber. So again, this is called a CT scanner detector, but it's basically an ionization chamber. And this phantom has 4 holes on the side, 1 hole in the center. So we check the measurements of the dose again delivered at certain kV in the center and in the 4 different positions for in a water equivalent phantom, just to get a standardized dose measurements. And similarly, the same ionization chamber you can see is placed here in air. So we do some measurements in air to have um, records of and standard measurements in air and water. So what are we checking here is 1 milligray delivered by the machine really 1 milligray? That's really what it comes down to. So we are checking the machine and the manufacturer that it is working per manufacturer specifications. So next coming down is nuclear medicine, which is my favorite, one of my favorite areas. As Sir mentioned earlier, I started as a medical physics technician. I'll just give you a workflow of a nuclear medical physics department, and I'll tell you what my role was in this. So when a patient comes in nuclear medicine department, the patient is injected with a radiopharmaceutical that is labeled to a certain element. Could be glucose, water, amino acids, based on where you want what part of the body you want to scan. So patient is injected. Patient has to wait for 4 hours, 3 to 4 hours, until the radiopharmaceutical is deposited and circulated. And then a patient goes for a scan on a SPECT scanner where a patient is scanned. So you can see something. This is just an example of an image of a SPECT scan. So the red part is some deposition of the radiopharmaceutical in the body. So a SPECT scanner is exactly like a CT scanner. It gives you an image like a CT scanner with a gamma camera detectors or gamma camera or gamma detectors. So this radiopharmaceutical is always, once injected, will start in your body, will start radiating gamma radiation. So when the patient goes for a SPECT scan, they do a CT scan, plus the gamma detectors will detect gamma radiation and will tell you where the gamma radiation has been deposited in the body. So the imaging part of this nuclear medicine is used for a diagnosis of a treatment to understand basically where the abnormal cells are present. So the good thing about nuclear medicine is it's imaging and treatment combined, and it's for targeted treatments. So targets where they are very localized in the body. only in certain organs, not throughout the body, and very low. And the thing about this is it's very low dose. So it's very low dose as compared to the other treatments. So it's safe and minimal risk for the patient. I worked here for 1.5 years. My job as a medical physics technician in nuclear medicine department was to prepare these radiopharmaceutical injections, and these were injected then by the radiographers. So yeah, the physicist in certain departments or medical physics technician in certain departments, they make this or prepare these radiopharmaceutical injections. The next part of nuclear medicine is the therapeutic or the treat, or where you actually treat using nuclear medicine. So this is I-131 or iodine-131 radiation therapy. So I-131 pill, it's a capsule, white capsule, which looks exactly like a paracetamol or a crocin. It's radioactive. It's a beta and a gamma emitter. So I-131 capsule comes in a lead shielded container, something like this. This is very heavy because it's fully shielded with lead to protect us from the radiation, whoever is delivering it and the other staff involved. The pill is somewhere inside here. So what basically happens is the patient swallows the pill or intakes or ingests the pill. The pill goes, because it's iodine 131, the thyroid absorbs most of the iodine 131 from our body. So the pill, so most of the iodine 131 is absorbed by your thyroid cells, and then it starts emitting beta and gamma radiation. So what does beta radiation does is it damages the DNA cell and the cell growth. So this is usually used for abnormal cells on your thyroid or thyroid cancer. So this after ingesting the I-131 pill, it starts damaging your DNA and the cell death in your thyroid. So patient ingests the pill, and the patient is isolated for 1 to 3 days in isolation suite in the hospital, because it's a very high activity. It's about 1,000 to 3,000 megabecquerels based on the prescription. So after 3 days, the patient goes for a scan, for a SPECT scan, and this is what a normal thyroid would look like. But this is what a thyroid with Graves' disease would look like. Graves' disease is just abnormal growth of abnormal cell growth on the thyroid. It has the same treatment like thyroid cancer. So anybody with thyroid cancer or Graves' disease would have something like this visible on their SPECT scanner. So this is just an example of the whole body scan. And if you zoom in, this is the thyroid scan. So as you can see, thyroid takes the most of the iodine, and it's deposited mostly in your thyroid on your SPECT scanner. This is also a SPECT scanner of post-131 scan. It's just a different imaging view. You can see a little bit different view of the image, and a different grayscale and a imaging modality, but it's the same scanner. It's the same scan. This is the electrometer like you would be using in your lab. It's same, it's just you use it in waveform patterns, and we use it in digital or to measure the current and the charge. And this is the well tap ionization chamber. Now everything delivered to a patient or everything that is administered to a patient is measured. So we measure the scale before administering to the patient, and make sure that it's within the prescribed activity. So yeah, this was also one of my role as a nuclear medicine when working in nuclear medicine. This is the therapy part of nuclear medicine. Coming down to radiotherapy. So radiotherapy has 3 different parts, or 2 different parts, I'd say. The first is external beam radiation therapy. So obviously from the name, the therapy or the radiation is delivered externally to the patient. So this is a LINAC or linear accelerator called Electa Versa HD. These are the ones we have in my current hospital at the moment. This is the treatment head which generates high X-ray beam, which shapes the beam to the tumor. This is a couch which is used, the tabletop and the couch, which is used for the accurate positioning of the patient. And this is the imaging system, so the X-ray tube and the imaging panel, which is used to make sure that the patient is positioned correctly for the treatment. So you don't want to treat in a wrong location. And this is a gantry which moves around a patient 360 degrees to deliver from different angles. So we test every aspect of this machine. I won't go into detail, but I'll give you some examples of what we do. So this is the setup of water equivalent phantom, sorry, tissue equivalent phantom. So we are mimicking that this is the patient here. Again, there is a hole here which has an ionization chamber in it. And what we measure is the dose out, again, the dose calibration or beam output. So it's the dose measured, what dose is measured at certain distance inside a tissue equivalent phantom. So it's the same concept like in diagnostic, measuring the dose at different angles, at different MV, at 6 MV, at 10 MV, at different voltages. The other test that we do, which is laser positioning accuracy. So we set up lasers which are used for patient positioning to a phantom. This is a mimi phantom with very tiny, minute, about 1 millimeter of markers or ball bearings at the ends. We align the lasers and we make sure that it's within our tolerance and they're not drifting, because wrong patient positioning will lead to wrong positioning treatment. So that's one of the important tests we do. And then how the beam is, the beam quality. So the beam is either could be flat or a beam could be symmetry. Each has their own benefits and consequences. So if you want a flat beam, we check if is the field evenly intense, if the beam is balanced, and if it's a symmetry beam, we check if the beam is balanced around the center. So it's a lot to it. This is just an example to give you a brief introduction of what there's a huge to it. It's much in detail, which I won't bore you guys with. Next thing of radiotherapy is HDR brachytherapy. This is one of my, again, favorite areas. HDR stands for high dose rate brachytherapy. High dose rate is, as the name suggests, the radiation is very high radiation is delivered over a short time. The isotope we use for this is iridium-192. Iridium-192 has a half-life of 73 days. And it is very tiny. So the source, actually, it's only this bit. It's about 3.5 mils. If you want to compare it, you could say it's about the same size as the grain of rice. So it's that small. And this is just a cable that connects it to it. So it's used for very localized tumors. Mainly in my center, it is used for gynecological tumors. It will be soon in my center used. We are trying to implement it for prostate tumors. So what we do with this, we have to do some measurements and some QAs so that we know that it is safe to treat with that. So the one of the measurement we do is the position of the source. So we program the source to go at a certain position, and we check that it is at that position. The source is actually recorded at that position that we program it to be. So like in this case, it's 1,400 millimeters. You could program it to be anyways. It's just an example. So basically what happens during the treatment is this source goes into the patient, stays there for a certain amount of time, gives out radiation, and then it goes out. Because it's such a high activity, it gives a very high energy gamma radiation. It doesn't need to be it's not a permanent implant. It only needs to be for a short period of time. So that's what it is. I remember when I was back in the day, when I was in undergrad, thinking, when I was studying nuclear physics, I was thinking, why am I studying this decay scheme and why am I studying the half-life? And it turns out that it has followed me to the career. So it was good to learn back then, and good to have this basis of all this. Again, everything is measured here as well. So this is a PTW electrometer connected to a ionization ionization chamber. And this is something called a source holder. So this bit sits inside here. And what we do is we connect this cable to here on top of this. So the source basically goes in and we measure the charge, and then we correct it to get the activity of the source. So that's how we measure that the source is decaying as it is expected to decay. Once in a while, every quarterly, we also use our own, our good old equation of A equals A0 e to the power of minus lambda t, do the manual calculation, and make sure that the source is decaying correctly. So yeah, the basics are still there. It's never been forgotten. Next, in radiotherapy is LDR brachytherapy. As the name suggests, it's low dose rate. So for low dose rate brachytherapy, we use iodine 1 to 5 isotope. It has a it emits very low energy gamma rays. So that's why they are permanently implanted into a patient. And they're used for large tumors. They are more popular in prostates. So at my current hospital, they are used to implant in the prostate gland. So this would also be my role. I'm a full-time brachytherapy physicist, if you'd like to say that way. So I do a lot of HDR brachytherapy, a lot of this, and a lot of LDR brachytherapy. So they're called seeds because they look like seeds. They're also very tiny. They're about 4.5 millimeters in size, again comparable to the grain of rice. So they are implanted permanently in the prostate of the patient, and then they go on emitting radiation for over 2 years. And because of their half-life is 59 days, after 2 years they are decayed to nothing. But the seeds, they're metal, so they do remain inside the patient. So this is just an example for you to show, like demonstration of how a prostate implant procedure takes place. So this is something called as grid, and then the needles are inserted through the grid, inside the prostate, and then the doctor implants the seeds inside here. Like, so it looks something like that after it's done. So the doctor does the insertion of needles and implanting, but the delivery of the seeds in the hospital, the measurement of the seeds, the preparation of needles with the seeds is all done by a physicist. So that's a huge physicist role in there. The seeds are so the seeds are actually, they come in like this. This is called this is called a seed cartridge. So like they are placed like this horizontally, and this is a counter. So I don't know if you can see it correctly because it says 5, 10, 15, 20. So this is a cartridge of 20 seeds. So we get some individual like loose seeds like this, which are again measured from the same batch to make sure to make sure the activity of the seed is what what was prescribed to the patient. So this is the seed holder. We use the tweezers to put an individual seed in here. The seed sits somewhere here in the seed spot. And again, we use the same kind of electrometer and a well chamber and measure the activity, measure the current and correct it to the activity of the seed. So that's LDR brachytherapy. So coming to preparing your career in medical physics, I think that's enough of radiotherapy and diagnostic. We'll talk about some career now. So obviously, educational foundation. You need some of the foundation which you all are halfway there already. You've after your bachelor's in physics, MSc in medical physics or PhD in medical physics possibly would be the next step. And then there are residency programs which are offered by a lot of institutions. Some of them offer an integrated program with masters. For example, in UK, they do a master's in medical physics for 1 year. So it's a 3-year course with masters in medical physics and a residency program for 2 years, and 3-year course together. So most of the universities, they offer medical physics, and then you can apply for their residency programs. I know BARC, they do as well some residency programs after the master's. So that's your educational foundation. To gain experience, any internships, any sort of internships, paid, unpaid, in this or any related field would be very useful. To have any projects, it doesn't have to be big. Any small research projects, a research is a research, big or small, as long as you have the results and your conclusion or your opinion or your conclusion on it. I think that makes a huge it's a huge thing to have on a CV. And also online lectures and webinars, I know the IAEA, International Atomic Energy Agency, they have a lot of online lectures and webinars on their website, especially during summer. They do this, I think, every once a week, and there are a lot of expert talks from all over the world because it's international. I know there are a lot of talks from presenters from India as well coming and talking, and it's a very nice thing. I think it's worthwhile attending if you have the time. To build key skills is, I think it's important to have, like, everything is getting automated now, as you know, with AI. So I think it's important and it's very impressive if you have some programming skills like Python or MATLAB, because as a part of the job, you're collecting all the results, you're having a lot of data. And then to not do anything with that data is just a shame. So data analysis and image analysis is also a huge part of this role. So to have do something in Python, something in MATLAB, I think it's worthwhile. And there are a lot of professional organizations and networking. Again, the best way to do is via LinkedIn. These organizations have their own pages or accounts on LinkedIn, and you can sign up for them. They usually have a lot of lectures, workshops, webinars. They also sometimes advertise jobs. So AEPM, American Association of Physicists in Medicine, International Organization for Medical Physics, IPEM, that's more for UK, and British Institute of Radiology. So I think it's all they are all very good to have connections with. So medical physics expert is it's a registration which is required if you want to work as a senior physicist in most places. So once done with MSc in medical physics, your MSc could be accredited or not accredited. I don't think it makes a huge difference. If it's accredited, it's good. If it's not accredited, you can still apply for the MPE. So there are two paths to apply for the medical physics expert. First path is you finish your master's, you go to your medical physics residency program, which takes 2 years, and then you get a job in the clinical area for 3 years. So you have total of 5 years, and then you can apply, or you're eligible to apply for medical physics expert registration. The other pathway is you do your master's, if you get a job, you're on the job for 5 years. So you record your continuous professional development or your whole portfolio, CPD portfolio for your last 5 years, and you submit your portfolio to get a registration. So there are two different ways to do it. This way is getting a bit popular now with a lot of residency programs. And this was, I'd say, an old way of doing it. So applying for medical physics expert registration, there are a lot of licensing and certifying bodies. So in India, I know the BRC, they do the licensing, and then the National Board of Examinations, there's an exam I think you need to pass, and then they give you the certification. The most popular one is the American Board of Radiology. They have two exams, level 1, level 2, to get the certification. And then in Ireland, there is the ICPM. And then in UK, there is the Health and Care Professions Council. So there are different licensing bodies. It's the same thing. They give you the MPA certification to work in that particular country or particular region. Radiation protection advisor is a step above MPE. So RPA could be is considered as a specialized professional ensuring radiation safety in hospital. So they provide expertise advice on radiation protection. So RPA role is more like a managerial role alongside with advising. So if there's a new hospital or a new clinic coming, developing a new clinic, you need an RPA to make decision on the calculations, what kind of shielding is required. If there is going to be a new linac, what shielding would be required, how much thickness of concrete, how much thickness of lead you need to put in for the shielding. So all these shielding calculations they fall under the remit of the RPA. So they provide radiation safety advice, they do the risk assessments, regulatory. So they make sure that the hospital or the center is compliant with the regulatory procedures. They're also responsible for training and education for their own staff, for the other healthcare professionals. If there's a huge incident in a hospital, overexposure, because incident happens, mistakes happen, they are responsible to investigate it, why it happened, and and to develop safety programs. So yeah, it's a bit of a role about MPE. So career progression as a healthcare physicist, medical physics technician is the first step, that and the requirement for that, a minimum requirement for basic for medical physics technician is having a bachelor's in physics. That's how I started. I started as a medical physics technician. Then if medical physicist is the role above, which requires minimum MSc in medical physics. And then to progress onto the senior, you need 5 years as a physicist and a medical physics registration, expert registration, which again needs 5 years for you to submit a portfolio. So it kind of goes hand in hand. The role above senior is a principal physicist. Principal physicist is again a more like a managerial role, and a report like where a senior physicist would report, whom a senior physicist would report to. So a principal physicist should, or technically should be eligible to be an RPA, radiation protection advisor. And then there's a role above principal physicist is a chief physicist, who, to get to a chief physicist, you need to be, minimum requirement is to have 3+ years of principal physicist. So yeah, the ladder is huge. There's a lot of career progression. Um, but apart from healthcare, the other career opportunities available are in industry. So in industry, there are imaging system companies like GE Healthcare, Varian, and Electa. Also, they're always looking for medical physicists to join their research and development team as they come up with new technologies. They need advice from the physicists. There are medical softwares that we use in the healthcare, medical software for radiotherapy, medical software for diagnostics. Some of them are Envision, Brain Lab. They also always looking for physicists or medical physicists to boost their research and development teams. So in industry-wise, there is a lot of opportunities. If you choose to do a PhD, you could work as a fellow researcher, or you could work as a professor as well. So in research and academia, there is a huge opportunities there as well. So yeah, just to conclude, turning physics knowledge into better patient outcomes would be our motto. So we work with the intersection of technology and healthcare. You're making a difference every day. So at the end of the day, when the patient gets treatment, you understand, or it makes sense why you are doing everything, why you are testing the machines, why you were measuring certain things. So it makes a difference in the real life. And medical physics as a career is very rewarding, satisfying, and intellectually challenging. So these are some of the online resources. If you're interested, you could visit and have a look at in your meantime, free time. And thank you.
We'll quickly go for a poll here. And so I will launch first. There is a quiz which Lisa has designed. So everybody please participate, please fill this. And there is another small feedback poll after this. Okay, I request everybody to be here. Please don't leave the meeting for another 5 minutes. Four people have answered the poll. Okay, in one more minute, we'll end the poll. Eight people have answered, waiting for some more. There is a feedback also, so please don't leave, even if you have filled this. 10 seconds to end the poll. Okay, I'll end the poll now. We can see the results. I will quickly have a feedback. Everybody, please fill this. After this, I request Michael sir to propose vote of thanks. Before that, anybody has question, you can surely unmute and ask. As the poll goes on, you may ask question also. Okay, anyone has question, you can ask as you are filling the feedback.
Hi Lisa,
Hi, how are you?
I am Zara Fatima from Royal College in
Yeah.
so I just wanted to ask that as you said you work alongside professionals. So do you work alongside like surgeons or doctors in the operating theater?
Yes, we do. Yeah, for the LDR procedure, we work alongside the consultants which are doing the surgical things of implanting seeds.
Okay, thank you so much.
7 people have filled the feedback, expecting more people to fill the feedback quickly. If there are any questions, do ask. If you cannot unmute, of course, you should be able to unmute, but if you do not want to unmute, you may put the question in the chat also. Okay, we shall end the poll in another 10 seconds. Yeah, ending the poll now. I request Michael sir to propose vote of thanks.
Hello, Lisa.
Hi, Michael, sir.
Yeah. Thank you very much
Yes.
for speaking to our students on behalf of our physics department at Wilson College. And thank you that you have come, being able to speak with our students on this medical physics. And we are very happy that you are doing very well in this field. Uh, Maybe some of our students will be inspired and probably they'll pick up from the information that you have given them. I also thank all the audience and all our students who joined here. It has been very nice, and I hope you all can get some pointers from Lisa. And I think Shetty sir will probably help in giving some of the material that you had presented, sharing some of the material with all the students. Thank you very much, Lisa, again, once again, and we hope that you can speak to us in the future also. Yeah. Thank you.
Thank you, Michael, sir. That was very kind. Yeah, I hope I've made some impact, and I'll always be happy to answer any questions if you want to connect via LinkedIn or email. And I'm sure Shetty sir will be able to pass on my details if anyone is interested. Thanks for having me here, and it was truly an honor. And yeah, thanks very much.
Thank you, Lisa.
Thanks
Thank
so much.
you, all participants. Thank you, especially thank you, Professor Aluwalia. Thank you, Bodhne Madam, Bhore sir, for joining this. And Uroshi Madam is here. And there are students from other colleges as well at our college. Okay, thank you, everyone. Okay,
Thanks,
we'll end.
everyone, for watching. I'll see you soon. Bye.